Hello everyone, welcome to the POCUS series. In this video, I will demonstrate you how to insert the PICC line in adult patients. Let's start with the introduction. So the patient should be placed in a supine position and arm should be abducted or extended to insert the PICC line. So before inserting the PICC line, we have to decide at what length we have to insert the PICC line into the individual basilic or cephalic vein. So first you have to measure the length from the second intercostal space to the shoulder and then shoulder to the cubital fossa. So third, you have to apply the local anesthetic at insertion site if patient is awake. Fourth, so if you are using the ultrasound to locate the basilic vein, then you have to start scanning from the medial aspect of the lower arm because cephalic vein is collapsed most of the time. So fifth, you have to check the backflow of the blood each and every step so that you can do the correction on that particular step. And next is when you insert the PICC line through the peeling sheath, you have to ask the patient to rotate the neck on your side or on insertion side so that you can prevent the PICC line going into the IJV. First you have to prepare the upper arm with all aseptic precautions. Here you can see we are applying the betadine and then you have to cover through this part with the whole towel. So this is a PICC line set. Okay, it is a 4 French 70 centimeter length PICC line for the adult patient. So in this set you can see this is a guide wire, okay, and this is a dilator including the tearing sheath, okay, and this is a blade, puncture needle, and here this is a PICC line, okay, that is 70 centimeter in the length, but you have to measure the length from the second intercostal space to cubital fossa before inserting the PICC line. And so this is a connector. At this end you have to connect the PICC line, and through the other end you can give the drugs or IV fluids. Okay, so you can insert the PICC line by two methods. First, one method is you can prick the basilic or cephalic vein through this puncture needle and then you can insert the guide wire. Another method is you have to insert the IV cannula. Okay, this is a IV cannula by the help of ultrasound, and then you can insert the guide wire through this IV cannula. Okay, so in this patient we will follow the second method. First we will insert the IV cannula and then we will insert the guide wire. The tourniquet, okay. Okay, so medial aspect of the lower arm. So what you can see that this is a big compressible vein, that is the basilic vein, okay. The tip, now I have puncture, okay, but you have not to remove the cannula, so you have to scan proximally and you have to advance your cannula. So you can see the tip of my cannula in the vein. So I have inserted almost two-thirds of my IV cannula into the lumen, and then I will remove the stellate. Okay, got it? So will insert the guide wire through it. Okay, so now we will insert the guide wire. Now, okay, it is going smoothly without any resistance. So it means, okay, so now I will remove this IV cannula. After putting a small nick here, so now I am inserting dilator and tearing sheath. Okay, so now I will remove this. Okay, this is a dilator and this is a guide wire. I will remove both, but tearing sheath will be inside the basilic vein, and we will remove this. Okay, so and next step is have to insert the PICC line through this tearing sheath. Okay, it should go without any resistance. 30-35. Okay, so गर्दन इधर करो, गर्दन इधर कर लो. Okay, so first I will insert around 40 centimeter. Then we have to check the free flow of the blood. Here you can see the blood is coming free flow from the PICC line. And the next step is okay, so now you have to remove the steering sheet. Okay, 45 centimeter length. Okay, we have to check again for the flow. Okay, so flow is coming, na? It is fine. Now next step is, now we have to remove this guide wire. Okay, so this is a guide wire inside this PICC line. Okay, so this guide wire has been removed. We'll fix it on the mark of 40. Okay, cut it. Cut kar do. Okay, we have cut it, and now we will. So next step is you have to insert this connector sheet over the PICC line. Okay, and so and then you have to connect the long length connector with the PICC line. Okay, so after fixing with the long length connector, okay, then here you can see it is fixed. And then next step is you have to fix this long length connector with this sheath. So now it is fixed, and you have to check again the free flow of the blood. Oh, now it is fine. If you fix like this, okay, then patient will feel difficulty in bending the elbow. So what you have to do, you have to make a curve, okay, here, and then you have to fix here, okay, but make sure PICC line doesn't kink here at this curvature, otherwise it will not get the free flow. So okay, okay, it is fine. Now we can push it. Okay.